So you might have heard this story. It's been all over the news. People just reported it, and I'm going to break it down for you. This is one of the scariest medical stories you'll ever hear. A man died of rabies from a kidney transplant, and it all started with a skunk. So picture this. A Michigan man is waiting for a kidney transplant. He finally gets the call that there's a donor, and everything looks routine. Everything looks safe. He gets the transplant. He starts recovering. And for a while, things seem to be going okay. But months later, something terrifying happens. He develops strange neurological symptoms, anxiety, confusion, numbness, trouble swallowing. Doctors run every single test you can imagine. And then they get the result that nobody expected. So when someone has a transplant, sometimes they do get sick afterwards. And oftentimes it's a disease called graft-versus-host disease. But this time, this patient actually had something that most transplant patients don't usually get, rabies. So this man never touched a bat. He never touched a raccoon. He never traveled. He never had any animal exposure. So how did he get rabies? The donor was actually infected before they died. And the donor, they got the rabies from a skunk. So rabies can hide in the body for months without symptoms. And the donor died of what doctors thought was a brain disorder. But it actually was rabies, and no one knew. And because rabies lives in our nerves and tissues, and the virus was basically sitting there in the donated kidney. So when the transplant happened, the virus was transplanted too. And by the time the man showed symptoms, it was too late. Rabies is almost always fatal once symptoms begin. So unfortunately, he passed away, and when investigators traced the source, they confirmed the donor had been infected by a skunk exposure. And here's the part that will shock you. Rabies doesn't show up on a standard donor screening. It's rare, it's stealthy, and it can be completely invisible until it's too late. So this case forced transplant teams across the country to rethink donor screening. Because one missed exposure, one hidden infection, one transplant can change everything. Rest in peace to these patients and strength to their families. And remember, before you pop a pill, before you get a transplant, or get any treatment, know the story behind where your medication comes from. Follow me for more stories like this.